The practice that I work in is incredibly busy. We see pregnant women from all over the Bay Area from various clinics, and it's not unusual to have such a busy day or night where you're catching up to 8 babies in a 4-hour period, though our record was 13 babies in 90 minutes. Fortunately, with the Level Pelvis Method, if you have somebody who is having a protracted labor, comes into triage with significant musculoskeletal pain, you don't have to spend a great amount of time doing the adjustment. You can go in and do the adjustment and hopefully help that woman right then and there. I had a patient just last night who was having significant back pain. Her baby was what we call occiput posterior, which means that normally when a baby enters the pelvis, the face of the baby is looking toward mother's spine. In an occiput posterior baby, it's looking toward the mom's pelvic bone. So this causes the back of the baby's head to hit the spine with every contraction. And it's extremely painful for the mother. Who knows how it is for the baby, but it makes for a long and protracted labor. These women are at a higher risk for C-section because their labors stall out. By helping adjust the pelvis with the Level Pelvis Method, you're making a little bit more room in the pelvis for that baby to start to turn into a better position to be born. It doesn't matter if your patient has an epidural or not, you can still use it to help that baby rotate around. I used it last night and we had a long protracted labor before I used it. After I used it, that baby did rotate around and came screaming out, which was just lovely for all of us. I love this method. It works well. I have an obstetrician friend who also was trained in the Level Pelvis Method, and often when we've been on together, we've been able to go into triage together and do adjustments and help both of our patients. So I can't recommend the Level Pelvis Method highly enough, and I think the workshop is an excellent way of spending your